Well, where's it at?
Good afternoon. It is 12 o'clock according to Verizon Times. I'm going to call this special meeting to order. Remind you to turn your cell phone off or to vibrate. And then let's please do the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Chris. Would you take the roll, please?
Councilmember Dalby?
Here.
Councilmember Rowe?
Here.
Councilmember Stevens?
Here.
Councilmember Myers?
Here.
Councilmember Berg?
Here.
Mayor Lazio?
Here. I'll need approval for today's agenda. Is there a motion?
So moved. Second.
Thank you, Mark and Matt.
Councilmember Dalby?
Yes.
Councilmember Rowe?
Yes.
Councilmember Stevens?
Yes.
Councilmember Myers?
Yes.
Councilmember Berg?
Yes.
Thank you. Is there anyone in the audience that wants to address the council? I don't see anybody, so I'm going to move over that. Is there anyone on the phone? Okay, let's go ahead and move to the items on the agenda.
Approve hire of a temporary part-time employee at the Water Pollution Control Facility. Recommendation, approve hire of a temporary part-time employee at Water Pollution Control Facility.
Is there a motion?
Move the recommendation is presented, Your Honor.
Second.
Thank you. We have with us Phil Bergmeyer. So Phil,
Yeah, so we've been down 2 employees. We run 24 hours a day, usually with a crew of 6 that rotate through there. One guy straight days, and the other 5 will rotate through the shifts, depending on who has licenses. But anyway, so we've been down 2 guys for a little over a month now. So we wanted to hire a part-time person to replace them until we get our new hires on board, which the interviews are scheduled for Tuesday next week. So we think there'll be a part-time hire to maybe around Christmas time or the first of the year, so the new hire can get acclimated to the job.
okay. Any questions, council? Okay. Take the roll.
Councilmember Dalby?
Yes.
Councilmember Rowe?
Yes.
Councilmember Stevens?
Yes.
Councilmember Myers?
Yes.
Councilmember Berg?
Yes.
Thank you. Thank you, Phil.
Resolution number 244, 2020, approve Humana as the city's post-65 retiree medical supplemental and prescription plans carrier as recommended by Mark J. Becker and Associates as our consultant for retiree post-65 insurance. Recommendation, pass and adopt resolution number 244, 2020.
Move the recommendation as presented.
Second.
Thank you. Okay, we have Kayla Moeller. So you're going to give us some background, Kayla?
Yes. Good afternoon, Mayor and Council. Tuesday evening, I did a short presentation with the background information as to why we started looking into our benefits. And I had some charts up regarding our tax levies and our benefit levy amount and how we are the highest city with our employee benefits levy out of all 940 cities in the state. So we are here today with a resolution based on some of that background, and I do have some more information today to give to you. The first thing that I want to explain is we did receive a formulary comparison for our RX or our prescription drugs. And that is on our website, which we'll go over here in a second, and also in your guys' packets. We have not received a formulary for doctors that our retirees are using from Wellmark. We're still struggling to get some information from Wellmark. But we do have a solution for our retirees to look up their doctors to see if they are in network with Humana. So having said that, I want to show you guys what we do have on our website and what is available to our retirees. And then we will also be sending out a letter to our retirees with all of this information in. And if they don't have the internet or a computer to look up their doctors, they are more than welcome to call us to look up those doctors for them. And some of them have already. They can just go to our City of Ottumwa website at ottumwa.us. And then if they go to the government tab and then go down to human resources, they can scroll down to where it says the retiree information for pre-1993 Medicare retirees. That first link there, it says current Wellmark Group Retiree Health Insurance Overview. That is what their current coverage is with Wellmark, okay? The next links that you see there are what we are presenting for approval today with Humana to start March 1st of 2021. That first link is the information regarding our premium, and it also explains in there that their deductibles will be waived for next year. The second link would be what coverage that they have, and if you'll go ahead and click on that one. Yes. So if you see on this link, this is what we've been able to provide, what Humana was able to provide to us with MJBNA, and it shows what their treatment coverage is, what their benefit, the network coverage, and the non-network coverage would be. So there's 6 pages of that information that they will have available to look at. Okay. And the next one is our RX coverage, and then the last link right there, you can go ahead and click on. That is the formulary that we have received from Humana, and this is all of the RX drug prescriptions that our retirees have used from April 1st of 2020 to September 30th of 2020, and what was covered by the Wellmark coverage is in those 2 blue columns, and the Humana coverage is in those 2 green columns. And the green indicates that it's a positive change, and then the red indicates a negative change. We have 17 of these drugs that will receive a positive change for our members, and 7 of these drugs will receive a negative change, or they went up to a different tier of coverage. So like their amount that they will have to pay for their prescription will change. And then we have 2 that will no longer be covered, but both of those are vitamin D scripts. If they would like the vitamin D, then they would just have to purchase the vitamin themselves. And then so again, we'll send this out to the retirees so that way they can look at what prescription is theirs and see if it's, a neutral change or positive or negative change for them individually.
Can I interrupt before we move
Yes.
away from that? Of the 7 negative changes, do you have any idea how many users of those medications there are? I can't really see it from this angle.
It's not on here, and I do not know how many users. I don't know if we received that information from Wellmark or not. Nick, do you know?
We don't have that information from Walmart as of today.
Okay.
Thank you.
Thank you. The important piece of this that we want to point out is, go back to the website. On the website, we have a link for our retirees to be able to look up their doctors. So if they click on the Humana Provider Finder tool, that is a screenshot, step-by-step instruction on how to find their doctor. Okay. So it goes step-by-step, and then we actually have the link on our website as well that they can click on, and then they can actually put in their doctor that they use, whether it's their primary care doctor or their specialist, and it will tell them on this website if they're covered in network or where they're at. And again, if they don't have access to be able to do this themselves, they're more than welcome to call us, and we can help them find their doctor.
Kayla, isn't it true that physicians could move in and out of a coverage? So again, there's no guarantee, even if we didn't change anything, that a provider may not be eligible next year.
That is true. I mean, even if we were to stay with Walmart,
Right.
We can't ever guarantee that a doctor is going to stay with that
Thank
network,
you.
or
That's
the provider that doctor is working for will stay with that network. And then just a little bit more of a summary from what I presented on Tuesday, if everybody did not tune into that. Our current plan, we are paying $530.50 per retiree per month on. And this plan, we will pay $209 per retiree per month on, which will be an annual savings to this city of over $476,000. And then the amount that the retirees have been paying is $102 a month. And for this next year, it'll be $83.60 per month. Okay. So,
Hey,
yes, go
Kayla, when you were back on the plan information, it looked like in the overview that most of at least the first few out-of-network services were still covered at 100%.
yes.
Is that correct?
Yes.
To where even if their doctor's not in network, it looks like many of the visits would still be covered at 100%.
That is absolutely correct. We have, even if the doctor is not in network, they will still be able to see that doctor out of network. And I don't know, do you have any more information regarding that, Nick?
Hey, Nick. Yeah, I'm here. Sorry, I was trying to unmute myself and I was struggling there.
Okay.
Yeah, I do have some information. As long as that provider is willing to accept Medicare and is willing to submit the bill to Humana, whether or not they're in network or out of network, the benefits are still the same. The key is just making sure they take Medicare and that they are willing to submit the bill to Humana.
great.
Thank you.
Good question.
Kayla, I got a couple of quick questions. What do the deductibles look like? You said you didn't get any information from Walmart, but with the current deductibles in place now compared to what the deductibles would be with Humana, is there a big change there, or are they about the same?
No, currently their deductible is $185 per year. And that's what the policy would have been next year. But like I said, Humana has agreed to waive that $185 deductible for next year.
Just to add to that, Kayla, it will go back to $185 in 2022, but instead of making employees pay possibly 2 deductibles, because the plan won't go into effect until the middle of the year, 3/1, Humana just tried to make that easier for members.
Nick, what if members hadn't met their deductible prior to March 1?
Well, that's kind of the reason that Humana is waiving it, because that is a possibility. So Humana doesn't want to cause any negative harm or financial frustrations to members by having to pay 2 deductibles. So it is possible that some members will meet their deductible by March 1, but there will be no second deductible that they would have to meet following that for the rest of the year.
Right. So if they haven't met it with Walmart, it doesn't matter if with Humana that's still waived.
So they could potentially have no deductible that year if they didn't need to see anyone until after March 1.
Yes. Yep.
Can you remind me real quick, was there any sort of rate guarantee locked in for this policy for 2 years, 3 years, or was it just this next cycle that it was locked in at the $200 rate?
You mean at the $185 for the deductible?
No, I'm talking about the
Monthly
overall plan
I got
rate.
you. Nick, is that $209? We're just going out for that annually, right?
That's an annual amount. That's correct.
Okay, thank you.
It's not a multi-year rate guarantee.
Okay.
And we have the ability to look at that on an annual basis then, correct?
Yeah, you have that ability.
So our goal has been to be sure that our retirees get the same benefit as basically as possible, no guarantee of 100%, but as much as possible, both in terms of medical care and the drug formulary. And with all insurance, it's subject to annual review, and Becker will help us do that.
Correct.
Okay. Any other questions from council? Any other, Councilman Myers, you're on the phone if there's any questions you have.
No, thank you. It's very well, it's been explained very well.
Are you ready to vote? Okay, take the roll.
Councilmember Dalby?
Yes.
Councilmember Rowe?
Yes.
Councilmember Stevens?
Abstain.
Councilmember Myers?
Yes.
Councilmember Berg?
Yes.
Motion passes 4 with 1 abstention. Okay, thank you, Kayla. We
Thank you.
appreciate the work, and our consultant has done a good job working with the city too, so
Yes.
appreciate that.
Thank you, Nick and Brenda.
Absolutely. Thank you, everyone. Have a great weekend.
Thank you.
Bye.
Is there any public business that needs to come up? Any council comments or any issues? I don't see anybody else that's knocking down the door here. The only public comment I would make, and I think this is something that we should look at down the road or as we go forward. The city of Ottumwa has been working for the past couple of years on a project called the ACE Studies. Councilwoman Berg is very familiar with this. She's been involved with the Resilient Community Project, and we have a booklet I'll give to each one of the council people that outlines the program and what's happening here in the state. And I think one of the things that we want to look at as a council, are there some basic things that we can do as a community to improve the life and quality of life for children and families that will move the needle, so to speak, on some of the issues that we don't want to be first in the state on. So I'll just give this to you today for reference, and you can look at it and read it. And then maybe at some point in the future, we can have Jill Lane, who is the project coordinator, come and address the council and do an educational session for the council and city staff. So,
Mayor, along
Yes.
with that, if people go to Resilient Communities Wapello County on Facebook, there are links for parents and business owners to take surveys regarding child welfare in Wapello County. And we're trying to get as many responses as possible. So if people go to that, the survey link should be on there.
very good. Thank you for that reminder. Okay. Anything else? Any other comments or questions? I think, and I'm looking at Edward, we'll probably bring it back to the council, and this will be something that Kayla will be talking about when we do our CIP, but equipment is something we spent a lot of time on last evening, and we have a need for some updating of equipment that's going to come into our emergency communication 911. So we're not prepared today to talk about it, but certainly Edward and Kayla will bring some information back to the council in the next meetings ahead. So with that, if there's nothing else, I'd entertain a motion to adjourn.
So moved.
Second.
Councilmember Dalby?
Yes.
Councilmember Rowe?
Yes.
Councilmember Stevens?
Yes.
Councilmember Myers?
Happy Thanksgiving, everybody. Yes.
Councilmember Berg?
Yes.
Okay, and it's 12:19. Thank you. And I'll pass these out to you now.